There's so many tenets to that question. So one of the things is, I think, for care providers to understand the patient perspective. And that it's not captured in a clinician setting. It's about, and I hate to use the word quality of life, but it is about what is the impact of that patient's life and their disease. And it's not just, for example, in hemophilia, it's not just your average bleed rate in a year. It is what are your pain thresholds? How healthy are your joints? How does that impact your day-to-day life? When a physician, nurse, comes to a conference like this, they get a chance to hear the patient perspective and really interact directly with the patient organizations as well. So the other thing is, I think it's extremely important because the patient advocacy groups that attend these meetings can also hear the physician perspective. They, in the case of NORD conference, they really emphasize sessions on access to care and treatment for these rare diseases. And for example, the last 2 days, the sessions have been filled with panels from the NIH, which, they are involved in the clinical trials process, and then the FDA. We've just had excellent sessions this morning from the FDA to hear the perspective of the regulators of these drugs that are coming out to the rare populations. The other benefit, there's so many, but the other benefit, I think, is that in the rare disease or disorder space, some of these populations are so small that it's very difficult for 50 patients across the United States to get, the attention of the federal regulators or the clinical trials or the docs or because obviously if you have such a small patient group, it's hard to find those experts. So when we all come together, we're all aligned in access to treatment and care. And so we have a larger voice together, and I think it's a bigger advocacy impact.